So we talk about broad categories of passive suicidality and active suicidality. Passive suicidality is the thought that, oh, I don't want to be around anymore. If I didn't wake up tomorrow, that would be okay. But it doesn't include a wish to actively bring about the end of your life. Active suicidality is where someone says, I want to die, I have a plan, or I'm thinking about a plan. That's what we consider active suicidality. Both carry a risk of eventual suicide, but we would consider someone with an active plan as being more risky. Passive suicidal ideation is a sort of way of, I guess, mentally escaping or mentally entertaining the idea that there is an escape. That doesn't necessarily mean that the person wants to commit suicide, and it's really important to clarify that if people are expressing passive suicidal ideation. So shame and stigma may play a huge role in people's willingness to talk, and I think you need to consider not only the individual but their cultural background, because I think in most societies, to a degree or another, suicidality is taboo or shameful. In certain societies, particularly some religious societies, it might be considered extremely sinful, and that may then create a huge barrier to people talking about it. It's also really important to recognize that when people are suicidal, they may be coming from a place of great distress, where they may already be feeling extremely emotionally aroused or very depressed, where a core part of depression is a sense of guilt, not wanting to burden others, not feeling worthy of care. And so those feelings altogether may be a huge barrier to someone talking, which is why, as someone who may recognize suicidality or the risk of suicidality in someone else, opening up that conversation in a non-judgmental way is so important. Before you even say anything to a suicidal person, recognize what's going on in yourself, because most people who aren't used to speaking to suicidal people are going to feel anxious. So take a breath, recognize the signs of anxiety in yourself. It's okay to take a little bit of time to think before you speak. And then just be curious. So tell me about your suicidality. Tell me about those thoughts. How long have they been going on? What's going on in your life that's led you to feel like this? You may then want to understand a bit more about the thoughts. So what sort of thoughts are you having? And then the really important question, which I think is important for anyone to ask, is, are you thinking about doing anything now? And what are you thinking about doing? And that helps you really make sense of, is this something that's been going on for years and they don't really have any plan to do anything? Or did something dreadful happen yesterday, like a breakup or a bereavement, and they're actively thinking about committing suicide right now? Really important to make sense of that. And I think anyone can do that. You don't need to be a clinician to do that. If you can show them that you can listen or inquire, ask about their mental health, ask how they're doing, ask whether or not they may be having suicidal thoughts. If you can ask those questions in a way that feels open and non-judgmental and give those people a chance to talk about it, you'd be surprised by how willing people are to talk about the suicidal thoughts that they have. I'd also really like to stress or debunk what might be a common myth, that talking about it with that person will not put the idea in their head and will not make it more likely for them to act. In fact, it will make them less likely to act. If you've just survived a suicide attempt or you're living with suicidal ideation, I would really encourage you to speak to a trusted person. That could be a friend, a family member, teacher, or a healthcare professional. There are two really great organizations that help people with suicidality. One is the Samaritans, and the phone number for the Samaritans is 116123 in the UK. It's anonymous crisis counseling, and you can call them 24 hours a day. There is another organization called Shout, which supports people via text message. And there are many other places that you can go locally, including day centers for people who have suicidal thoughts, where you can go for informal anonymous counseling. So please do search locally for the suicide prevention services that are in your community. If you get a response from the person that you speak to that feels unsupportive, uncomfortable, or unhelpful in any way, don't let that put you off speaking to someone else. Find someone else or consult another professional who can support you. There will be someone out there in your life or a professional person available to you right now who will be able to support you in a way that feels collaborative and doesn't make you feel ashamed about your thoughts.